The aspect of global health security is now an integral phenomenon to accelerate progress towards a world safe and secure from infectious disease threats. It is meant to urge countries to prioritize capacity to prevent, detect and rapidly respond to biological threats to promote global health security as an international priority.
The Global Health Security Agenda is a multi-sectoral, multilateral effort that was launched in 2014 to accelerate progress towards compliance with International Health Regulations 2005, the World Organization for Animal Health's Performance of Veterinary Services, the Biological Weapons Convention, and other relevant international frameworks and agreements. The IHR 2005 is a legally binding instrument which was adopted by 196 WHO member states that set requirements for each country to prepare for health emergencies of all types.
In 2005, member countries of the Global Health Security Agenda, in a bid to mitigate the impact of naturally occurring outbreaks and accidental or intentional releases of dangerous pathogens, drafted an action package to spur full implementation.
When we initiated this approach, we had 4 key lead sectors. That was agriculture, Ministry of Health, Uganda Wildlife Authority, and then Ministry of Water and Environment. The original purpose was in response. However, we realized that response alone was not enough. So we realized that we need to also have preparedness activities. So when we established that platform, we now developed what we call a national strategic plan from 2018 to 2022. Now that one has a series of activities which can guide us to move systematically for the next 5 years.
The next activity is focused on developing an emergency supply chain logistics program designed to distribute commodities like personal protective equipment, which is critically needed during outbreaks. The Ugandan Health Supply Chain Project implements this activity. And then finally, USAID builds upon more than 2 decades of work addressing antimicrobial resistance by promoting antimicrobial resistance stewardship and preventing healthcare-associated infections.
Outbreaks of infectious diseases with potential to spread across districts, regions, and even the entire globe continue. This highlights the need for continued prevention, detection, and rapid response capacities to help create a safe world secure from infectious disease threats. CDC's global health security work focuses on the core foundation for a strong public health system. This includes strengthening disease surveillance networks, establishing capable public health laboratories, and building a competent public health workforce.
We've managed to share something on One Health in West Nile. Why? Because there was a problem there of anthrax. So we really realized that the biggest challenge there was failure to collaborate.
The concept of global health security underpins the current framework for global preparedness and response to emerging infectious diseases.
And partnering with organizations to help build these capacities. CDC has a world-class repertoire of scientists and public health professionals who implement key disease detective activities and train the public health workforce of the future. We diagnose novel and re-emerging pathogens with world-class labs, and we deploy laboratory assets to the front lines where our innovative technology can help yield higher quality results, even in resource-constrained environments. Another important component of CDC's global health security work is our agency's ability to monitor threats globally from our headquarters and to provide rapid response through deployment of staff from across the agency through CDC's Global Emergency Alert and Response Service.
In 2014, Uganda became one of the countries that agreed on the need to measure progress on the set priorities in respect to the international health regulations.
I must also say that as a country, we are open and embrace whatever research that is going on in other countries. For instance, we are now talking about the Ebola vaccine because of that openness. For as long as we know that this is moving, it is a positive trend and it's moving towards helping our populations, we welcome these initiatives in our country.
This definition of health in a multi-sectoral way has been there well before. defined by WHO way back in 1940s. But the practice of it was neglected because the populations were small. With the pressure that we have now of a population explosion, encroaching on ecosystems, environments that previously were not for human habitation, we are interacting with animals and therefore popping our hands into viruses and bacteria that are now beginning to encroach on us like Ebola. So the efforts of one hand, of one profession of medicine and health is no longer enough. You now need to prevent the flow of these germs from where they are, so veterinarians come in to do preventive medicine. You now need the role of ecologists who will be able to map out and tell you what makes these germs live the way they do and succeed. You need the services of wildlife experts and frontline workers. In case there's an outbreak, there should be a team which is skilled to rescue the lives of people. Not everybody will go because this is an issue of dealing with invasion. So one health workforce to be molded will require multidisciplinarity.
One Health has enabled me to use the knowledge from my course to give back to the community.
If you really want to know whether preventive medicine works, then come join One Health and at least have a training with them. It's the best chance, it's the best opportunity to learn.
I think this training will particularly help me with my community-based project next year. I've learned how to do community assessment, and I think I'll be able to come up with interventions and how to exit next year. Yeah.
International monitoring bodies including World Health Organization, Food and Agriculture Organization and the Organization for Animal Health working together formed the One Health strategy to implement the agenda. Technical experts have since adopted the guidelines formulated under One Health.
Essentially, we have developed courses and training materials that address issues in One Health. We have worked with our partners, our US partners, universities, University of Minnesota and University of Tufts. We have also worked with ministries of health and ministries of agriculture and ministries of animal husbandry in the different countries that we are in. Essentially, to bring them on board that whatever we are doing, we have the blessing of the governments, the policy makers. And for the universities, we have been able to break the walls of having universities to work together, looking at the curriculum together. Because, you know, different universities have different policies. And how we have achieved them is that the different universities have brought together students. We have brought together student clubs in universities and other institutions, so that we sensitize them and we integrate One Health training into the curriculum.
By integrating One Health skills and competencies into the classroom and hands-on training programs in the field for current and future workforces, OHCEA is transforming the workforce by creating a pipeline of professionals with multi-sectoral skills needed to prevent, detect, and respond to infectious disease threats.
Of course, certainly Uganda as a country, we've had a number of outbreaks. There's viral hemorrhagic fevers outbreaks. We've had the Ebola outbreak, and so many lives were lost. So over the years, you remember when we had the first Ebola outbreak, so many people lost their lives. Over 200, the Gulu outbreak. So as a result of that, we as a country had to ensure that we build our own capacity internally in terms of diagnostics, improve our own capacity in terms of surveillance, detection, and of course also build the human resource capacity. And I must really say that as a country, we have done well on those fronts.
Uganda's health ministry is now working towards linking public health with law enforcement.
Of course, we have the Public Health Act. It's currently being amended but I must say that generally the communities in Uganda have been really very cooperative. We have not gone into really maybe the law enforcement aspect of maybe taking on a person who has failed to report a disease outbreak in his or her community. That is something that maybe when we, as we amend the Public Health Act, we could actually put that there. But generally I must say that Ugandans have been very, very cooperative. When there are outbreaks, even at the farm level, they are able to report, and of course the veterinary officers are all over the district, so they are also quick to come in and provide the necessary intervention so that there is no spread of these diseases like anthrax, Rift Valley fever, and so on.
Several countries in Africa have developed specific tools and programs that can be tailored to build capacity and address country development needs.
In Cameroon, the biosecurity and biosafety process is also supported by a series of laboratories carrying out activities such as the detections and the monitoring of biosecurity issues and risk. Here we can mention, for example, the biotechnology laboratories at the University of Yaoundé 1 and the one of the University of Buea. Here can be mentioned also the Laboratoire Pasteur, the Centre Pasteur, which is assisting Cameroon to detect and identify pathogens and some diseases, whether in livestock or in humans. And we have the John Hopkins Institute, which is their presence, and a cohort of laboratories coming up to be able to assist the government in different regions, different sectors, in case of any crisis. So, but generally in Cameroon, the operational unit in charge of biosecurity is the biosecurity project, which exists, which is there, which is operational.
We have developed modules for short courses, and these short courses we have involved the personnel that are already in service. We have involved people who have farms to train our students on the farms, both medics, nurses, and veterinary students. So essentially we have implemented One Health workforce as a practical model of training people with hands-on, identifying the problems together and integrating them into our curriculum.
Overall, the Global Health Security Agenda recognizes that is now one world, one health, one medicine, one economy. Therefore, the universities can no longer work and do things in isolation. They have to keep to the overall agenda of the global community to ensure that trade can go on normally, tourism can go on normally, the global travel can go on normally, the transfer of resistant genes is prevented. If you take an example of Uganda, there is massive use of drugs. Drug shops are everywhere. You can access antibiotics anytime without prescription. That in itself is a risk incubator for development of antibiotic resistance.
And the process to have other countries adopt the guidelines is still ongoing.
CDC is working with countries to closely identify the gaps in the JEE and address them, to develop national action plans that are country-owned, which can be implemented through coordinated efforts of host country governments, donors, technical partners, and CDC is included.
The challenge is the goodwill of the policymakers. Every policymaker we have approached has responded positively. But in other countries, we know it has not been easy.
Global health security is a shared responsibility that can't be achieved by a single partner or sector of government. Its continued success depends on continued collaboration among the health security, environment, and agriculture sectors.
When USAID leaves, how do we handle this? We need to provide appropriate budgets to support this.